18 that the Ashanti region is supposed to benefit from? Where are we with them? Are all 18 underway?
There are 19 hospitals in the Ashanti region.
Exactly.
We have virtually gotten land for all of them. Where we have land issues that we sorted it out now is Akrofo. Akrofo is full of rocks. And luckily, we've been able to have the land filled in some place and then the right thing done in some place for them to continue the work. In Obuasi East, at Kabrakwa, we also had a problem there. They've given us a new land. As I speak, it's now being prepared and then a contractor is on site. We have added Ejura to it. Ejura, the contractor is on site. We've added Wadi Makasi. These are the new additions. Also, the contractor is also on site. He has graded the place. He has cut the place. He's doing the grading and the work will start. For example, these places are starting new. So it's not because we want roads in December. It will not finish in December. But it will go to a considerable amount to be completed. And that is what the people there want. They want hospital. And then if you go to all the other places, Minahini is ongoing. As you said, which was cut, the sword was cut, is about 75% completed, and we are very certain that they will finish very early. Kokobin in Oforikon is ongoing. Barakese is ongoing. Boama is ongoing. Insutakwaman is ongoing. One of the contractors was not doing very well. We terminated the contract and we have re-awarded to another contractor. He's fully on site. It's all ongoing. So most part of the hospital in Suta has been roofed. If you go to Mansour Dibia, it's also ongoing. One of the contractors was not doing well. We've terminated, given to another contractor. If you go to Kunsu, Mankraso, it's also ongoing. Go to Adijama, it's ongoing. And if you go to One, the first time you're going to have a psychiatric hospital, a regional psychiatric hospital, I call it regional or zona. It's for the middle zone of this country. It's also ongoing. So all the sites in the Ashanti region are all moving very fast. And except, as I said, Nsiah-Asare, which had a peculiar problem which has been sorted out and is going to go on. There's one in Bantama, which is also going to be a double stack because that will be a different design than unlike the other one. That is yet, the contractor has been given the site, is yet to go there, go and start. And the one at Asokore-Mampo in the airport enclave is also, as you speak now, you go there, the contractor has started the the substructure, it's also ongoing. So all the 19 projects in the Ashanti region, God being so good, are all moving very fast. The same thing is happening throughout the country. That is the beauty of Agenda 111. It's not only in one or two regions. It is in all the 16 regions. And if you go to Volta region, what is there is also moving very fast. You go to Oti, it's also moving. We went to Pasa, and we showed it to the good people of this country. We've visited most of the sites in the southern sector. We are here to go to the northern sector, which hopefully we will do it in January to also monitor all this. It's a project which is ongoing, which we are monitoring very, very, very strictly and making sure that things are working well. There are also zonal consultants who are there who are also monitoring and giving us report, apart from the coordinating consultants. So these are projects that everybody is very key, and we put our eyes on making sure that we finish it. What we can finish this year, and then for the good people of this country.
Can you assure us that we have...
Because of IMF conditionalities, we have put a hold on it. But to me, the most important thing is that if most of the districts have their own hospitals, which are state-of-the-art and modern, unnecessary referrals to our teaching hospitals and tertiary institutions will go down. And as we speak now, the regional hospital even at Takoradi is also ongoing. If you can die, it's being rehabilitated also quickly. So these are some of the things that are happening in this country.
But Doc, are we in the position to complete all these projects so we don't have them stalled for decades like we've had some projects? Are we in the position to complete all of them?
Moving on. We will complete all that we started. The 91 which have started. We are moving on, and after going around a northern part of the country, we will have a press conference and tell you and give you the phases that we are going to finish. We are not going to finish all in one day. That this number of hospitals, and you mentioned the names of the hospitals, will finish at this time. This one will finish at this time. And with God by our side and everybody supporting us, we will finish these hospitals for the good people of this country. And to me, it doesn't matter because of elections. Any government who comes, when there are some projects going on, you have to complete them. You have to continue if it's not completed. But we are going to complete a good number of them before next year this time, and you see it here in this country. We continue talking. You can call us, and we'll give you the updates as we move on.
When it comes to the Agenda 111, I know that first quarter next year, the president will be commissioning a lot of these projects like the ferry and the Sewa and all that. Are there any of the Agenda 111 projects in the Ashanti region that will be commissioned first quarter next year as well?
No, we hope that by the second quarter we'll complete and commission some of the hospitals in Ashanti region. I'll give you the number later or not now.
Will that include a psychiatric hospital?
So there'll be a lot of commissioning of hospitals next year.
In the psychiatric hospital?
And there'll be a lot of commissionings of hospital, completion of hospital and commission and use of hospitals next year. So we all pray that God gives us a long life and good health to see these things happening in this country. You see, after COVID, we learned a lot of lessons in COVID. And luckily, as a presidential advisor and as a doctor who has worked from the district, regional to the teaching hospital to the national level, I'm so happy that COVID was very disastrous, but COVID has brought something in this country. COVID has now made health as a very important agenda in this country. That everybody is now conscious that you have to be healthy to keep going. And we have to prepare ourselves for any future pandemics. That's exactly what His Excellency the President did during the COVID period. Apart from the leadership that he gave to this country, especially those of us who are at the forefront of COVID, the National Task Force, that he himself chaired all the meetings, with His Excellency the Vice President also sitting in. So you can see that we are very much concerned about the health of the people of this country. And as you remember, he made two very pronounced statements during his State of Nation address, which we call fellow Ghanaians. He did 29 of them. No country did that. And everybody, if you go to the international world, especially where health systems are, everybody thinks that Ghana did very well. We didn't say it. Among the three countries which managed the pandemic very well, Ghana is one of them. And it's well documented. He said that he cannot bring a human being back to life, but he knows how to bring the economy back. So we're doing everything to make sure that we don't lose people. The fatality of COVID is 0.8%. We are one of the lowest in the world. And people will say that it's not true. But we didn't see people dying on the streets. We didn't see people, our mosques and our cemeteries full of barriers. That is one. Two, he also said that we should turn this crisis into opportunities. And that is the reason why we realize that there are about 88 of the 217 districts in this country which didn't have any semblance of a district hospital or a first primary referral center. And that's the reason why we started that. We wanted to put hospitals in at least all the 88 districts. You remember, initially, we were talking about Agenda 88. Then we realized that there are some of the districts, either you like it or not, are so wide apart that if you put a hospital in one place, then the other side will not get the good, you will not be able to access the hospital. And then there are some of the old hospitals which were not hospitals. A district hospital is a place where is the first primary referral center, where they have doctors, where they are nurses, physician assistants, laboratory medical scientists, they are pharmacists, and then the whole support staff. Where a hospital is a place where there's a kitchen where we feed the patients so that they can get the right food to eat and everything. And that is what we are doing in Agenda 111. It's a state-of-the-art, fit-for-purpose, first primary referral center of all the modern facilities. There are 60 beds, there are 100 beds, depending upon the population of the district or the municipality. But the equipment and the functionality will be the same. There's children's work, and then more importantly, because we are doing it during the COVID period, because of post-COVID, we also did it in such a way that we will not crumple patients together in OPD as maybe you see in some hospitals. And then we also added some intensive care beds so that we have critical or high dependency beds across the length and breadth of this country. So we don't move patients, as we saw during COVID period, with helicopters from Bolgatanga to Accra because we have very few critical care beds. And then it has all the necessary facilities, including mortuary and all these things, and including a maintenance unit where we can maintain and give planned preventive maintenance. So it will create a lot of jobs for our health professionals and non-health professionals as well. It will open all these districts up. We went to a district and we realized that because of its proximity to the border of the country, it will also become even a medical tourist center for the neighboring countries. And that is how you attract investment even to such areas.
Doc, what I'll say is that we would end here. The next time you're in town, the next time you're in Kumasi, let's have you join us in the studios for some more conversations. But we're going to take your